to the statistics that we have. There have been a combination of factors contributing to the increase in excess deaths, including in the last year high flu prevalence, the ongoing challenges of COVID-19, like the strep A outbreak, and conditions such as heart disease, which we touched on, diabetes and cancer. Because we had virtually a lockdown of routine health services over a 2-year period, many of those are now coming forward with increased morbidity and mortality as a result of that. And starting with winter flu, the number of positive tests last year peaked at 31.8%, the highest seen in the last 6 years. And interim analysis from the UK HSA indicated the number of deaths in England associated with flu was far higher than pre-pandemic levels, so excess deaths due to flu last winter is sadly part of the answer. And he touched on the independent body of the ONS. Well, their figures show that the leading cause of death in England is still dementia, which accounts for about 10% of all deaths. But they do also look at the cause of excess deaths, and if you look at the figures as of June this year, the top 3 causes of excess deaths are respiratory illnesses, dementia and ischemic heart disease, which is often caused by an increase in cholesterol, smoking, not having a blood pressure check. So there's a number of reasons, and they are often chronic conditions that people have had for years, decades in fact, some people, and are not acute illnesses. Now, just to touch on some of the points that he has made in these points in the 3 minutes I have left to respond. Firstly, turning to the importance of vaccination, I think it's very easy to say that there's a prevalence of high rates of COVID vaccination in people who have died, and that is correct. When 93.6% of your population has had at least 1 dose of the vaccine, there will be a high rate of vaccination in excess deaths. That is different to causality. I completely agree with them, there's a high prevalence rate. That is not the same as saying that that is the cause of those deaths.